So Kathryn Dirks is here, and she is the president of an organization called HSTAT. And I met her this past Friday at a rally at Grady Hospital. She is a super impressive person, and so we've invited her to come on and share with our listeners a little bit about how it is and why it is that she has become involved in the fight for single-payer health care in the United States. So hey, welcome to the Reliever Forum, Kathryn.
Thank you, Diane. It's a real pleasure to be here.
So why don't you tell folks just a little bit about yourself, where you go to school, what you're doing?
Sure. So yeah, I'm a graduate student at Emory University's Nell Hodson Woodruff School of Nursing. I'm studying to be a certified nurse midwife and family nurse practitioner there at the school. And I'm also thrilled to serve as president this year of Health Students Taking Action Together, or HSTAT, which is a nonprofit student-run organization that advocates for the health of Georgians. So we've got student members from all of the health disciplines. We've got physical therapy, we've got student doctors, we've got nurses, public health students, who've all come together across the state with the goal of improving healthcare here in Georgia. We do that through kind of several branches, I would say. We've got educational opportunities. We put on lectures at the various schools across the state. We recently screened the documentary Death by Delivery that brought to light some of the issues around Black maternal mortality in this country. We also put on some really incredible programming. We're able to partner with Mercy Care to do a program called Street Medicine, where we're actually sending health students out on a mobile clinic to serve folks experiencing homelessness right where they are on the street, which is a wonderful and valuable experience. And then finally, we do a lot of advocacy work. We're training students how to talk to their representatives, how to be influencers for policy, and putting action together like what we did on Friday at Grady. So we sort of like to say that we're trying to make students into an advocate and sort of make this a professional habit for when they go out into the world and really develop students as future healthcare leaders.
Okay, because I would say that a lot of people, when they think about doctors, I'll just say this, people think about doctors, one, people are aware of the tremendous cost it is to go through medical school, and I actually don't know about the cost to all the other related health professions.
They're also quite high.
And so really what that does then in this society is if people are loaded down with hundreds of thousands of dollars or multiple tens and tens of thousands of dollars when they graduate, that sometimes forces them into a more profit-driven kind of medicine. So could you talk about why it is you think that single payer sort of also would alleviate this kind of push for people who go into medicine because they truly want to, as you say, help improve people's health, but then because of their own personal situations sometimes have to take jobs where people are just sort of shuffled through 10-minute appointments and boop, off to the next one. Mm-hmm. So could you talk a little bit about that?
Sure, yeah, it's a great point. And I think first I want to just acknowledge that we do have an incredible shortage in primary care providers in this country and in the state specifically. As a midwife in training, I'm especially aware of the shortage in OBGYN providers in Georgia and our incredibly high rates of maternal and infant mortality in this state that really look a lot like what you might see in a developing country, and that's in our backyard. Those are our sisters and our mothers. And so the first thing I'll say is that sort of as a nurse practitioner student, building the workforce of nurse practitioners, physician assistants, and midwives in the state is really important to expand that primary care workforce, because it's true, a lot of physicians in this country choose to go into specialty care either because of interest or because of needing to pay back that debt. And I think what we find is that I think just to step back and kind of talk about single payer generally, what we find in this country is sort of a fundamental misunderstanding about what healthcare means to people. I mean, I would argue that healthcare is fundamentally a basic human right, and this is something I think as a country we need to come to acknowledge. we have an obligation as providers to serve people, and I think as humans we all know that healthcare is going to affect us. We're going to need healthcare at some point. The billionaire's daughter will need to get the vaccines just as much as a poor person's daughter. We've all had the flu. We've all, many of us have been lucky enough to have children, and so I think that sort of speaks to this human need for healthcare, and it's something that in this country we haven't really acknowledged. And so if we have this right to be free of suffering, I think the fact that being poor in this country and being excluded from that right is really a shame, and that we have a responsibility to change that so that all people can benefit from the incredible providers that are in this country and the incredible breakthroughs in medicine that we've achieved. So this kind of allows us to achieve our full potential as humans, and in fact has incredible impacts on things like the labor force. A healthy country and a healthy group of people means healthy workers and perhaps a stronger economy. So coming into my clinical experiences and seeing people sort of having to make really incredibly difficult choices between life-saving medications for very treatable diseases, things we've had medications for 100 years, and putting food on their table, that just should not happen in this country. We really should not have to be choosing life-saving medication and our ability to pay rent and buy food. So to your point about primary care, I think if we were to equalize access to primary care, and clearly in this country, the health inequities are huge, right? Many people cannot afford health care. They cannot afford to see a primary care physician or provider. And so in the end, we end up with folks who are having uncontrolled sequelae from these diseases that could have easily been prevented in primary care, or kind of stave off some of these really life-threatening diseases that end up, or consequences that end up from a disease, and we see that we have very expensive hospital stays where we might have avoided this by investing in our primary healthcare workforce and investing in people being able to access that primary care. So just to give you some numbers that I thought would be kind of interesting, we know that 30 million people in this country don't have access to health insurance, and here in Georgia, it's estimated that 1,700 people die every year as a direct result of not having health insurance. And those are deaths that could have been prevented if we invested in primary health care and in health care generally in this country.
Okay, so the debate right now is over people having a form of insurance, which is a privatized form of paying for health care. So what's the difference between what was called Obamacare and single payer?
It's a great question. So the Affordable Care Act, which is commonly known as Obamacare, it offers an opportunity for folks to buy into the existing insurance company sort of scheme, like what you just mentioned, that this private mosaic of many different insurance companies providing all kinds of care to people, but at all kinds of varying prices, varying levels of quality. And so while the ACA, I think, has been life-saving for many people and a huge help to many people, it really sort of just lets more people play into a broken system. So I think what the debate is starting to look like now is, could we devise a system where all Americans are in, all Americans are covered, we eliminate this kind of overwhelming bureaucracy of many different insurance companies with many different payer schemes, kind of standing in between you and your physician or provider, and kind of dictating what sort of medications you can afford, what kind of care you can get, what kind of provider you can see, where you can go to seek care. And so the fundamental difference is really about how we set up the system. So the ACA plays into the existing system, and unfortunately, as many of our listeners here probably realize, Georgia is among the few states who did not expand Medicaid under the Affordable Care Act, which was a huge failing on the part of the state and on Governor Deal's part, because it means that one of the most important tenets of the ACA, which is to allow people who don't make enough money to be able to buy health insurance but make too much money to qualify for Medicaid under its current scheme, they would have been able to buy health insurance and would have been covered. Instead, we're left with 30,000 people who kind of fall in this gap area and really can't can't make the numbers work, can't afford to buy healthcare and still, put food on their table and pay rent. And so while it was a really good step forward, I think the debate now is starting to shift toward how can we change the system as a whole to be able to cover all Americans. And it still would be a system where healthcare is provided by private institutions. So this isn't exactly socialized medicine wherein doctors and hospitals and things are working for the government. This would be a system in which we all pay in to the pot through our tax dollars, similarly how we do with school system or roads or something like that, and then we'd all be able to be under this universal health care. We'd all essentially be in on the insurance. We'd all be able to get the same coverage. Rich people, poor people, everyone in, nobody left out. And the healthcare would then still be delivered by private entities, but they would be paid out of this pot that we've contributed into, rather than how it is now, where folks are paid by this very bureaucratic, very difficult mosaic of insurance companies at different rates and are under a lot of restrictions in terms of what they can provide based on that kind of mess, essentially, of the insurance company scheme. And then finally, I'll just say that, that those insurance companies then, they're really not beholden to your health or motivated by whether or not you're healthy. They're really beholden to their stakeholders, and they're profit driven. So in single payer, we would be motivated by the health of citizens, and they would have all these incredible kind of consequences because of that. It could mean that we could capture what's making people unhealthy in the country, be it maybe clean water or better housing, and start to sort of improve these things as a way to hold down costs. We also can see that people are often staying in jobs that they're unhappy in, or not, they're not able to express their creative side or follow their dreams because they're really stuck in a job because they need the health insurance. So I think the right to health care, it's not an issue of left or right. It's this right or wrong. We need to be investing in health care for all Americans, and the current scheme just it doesn't do that.
All right, Kathryn, we're going to take a little break. Verdaillia hasn't walked into the studio, so we'll just keep our conversation on healthcare until she does, and then we'll talk about education. So we have some messages from WRFG. Please stay tuned, and remember that you have multiple ways to contribute to WRFG during our pledge drive. Welcome back. We are here now with a full house in the Labor Forum studio. So we've been joined by Verdaillia Turner. She was actually out in the lobby. I just didn't see her. And so we're going to just finish up with Kathryn by asking her for some information about how you can stay more in touch with this HSTAT and the struggle for a single payer. Then we'll move over to Verdaillia and a great conversation about what's going on with public education here in Metro and Atlanta, and of course in the country, with the current education secretary, for example. So here we go with Kathryn and her information.
Thank you. Yeah, I'll just encourage everyone listening to visit hstatga.org to learn more about our organization, to join our mailing list. And we are a nonprofit organization, so you can donate there as well. And if we have any health professional students who are listening, I'd love to invite you to join our mailing list so you can get involved in some of these issues.
All right, thanks so much. All right, so now a very quick introduction to Verdaillia Turner. She has been on this program multiple times before. She is one of the leading fighters, certainly in Metro Atlanta and the state, and probably the country, for quality, fully funded public education. And of course that means that the fight against the privatization, the move towards charter schools, the move towards taking education decisions away from communities, parents, and teachers, and moving it to corporations, and especially profit-driven corporations, is a central feature of that fight. So welcome, Verdaillia.
Thank you so much, Diane. I'm so glad to be here today. And Diane didn't ask me to do this, and I don't know if we're in fundraising season.
We are in fundraising.
But the Atlanta Federation of Teachers is going to pledge $100 today, and we're asking everybody else to do that. The stations such as WRFG are invaluable to the community, and we're asking everybody to support this station.
And just to say, everybody who pledges $100 or more gets 2 tickets to our Carnival of Cultures
Oh.
on December 3rd.
Oh, my
You
God.
didn't even know that.
No, I didn't.
No. And now you have a real bonus. And I also remind people that we have that tickets to that concert, December 9th at Helium for a $89.30 pledge on a credit card. Gets you 2 tickets to Who Dost with John Stringer and the young woman whose name I just blanked on. But I'm sure it's going to be a great concert, and it's expected to sell out. All right, Verdaillia, you are one of the most passionate advocates for quality education here in Georgia. So spill your heart.
Well, education has helped to make this country great. And most of us went to public schools. The majority of us went to public schools. And I'd like to say the reason why we can still drink the water and breathe the air and call a fireman is because of a public school, or go to an emergency room. It's because of a public school. And just as we have an attack on our country, period, there is an attack on public institutions, such as our great public schools. Now, we've said before, unfortunately, people point to those who go to jail, but from these same schools, people are going to Yale. And what the public does not understand is that when they start getting reports from the state, that many times these reports and tests are politically driven by profit companies in order to give the public a skewed idea, just one snapshot of something about a public school, and usually it's negative. But what this state has done, and so many other states similar to Georgia have done systematically, they have cut the spending, cut the support, cut the programs, and at the root of everything that we see in terms of what's going on with public schools and any deficiencies is rooted in poverty. And those are all the inequities that we talk about in this country, period. From the very foundation of the country all the way up to now. It's just like a cancer that's going over and over and over again. There is a movie, Diane, called Backpack Full of Cash. And Matt Damon did a wonderful job in narrating that movie. The other night it was shown over the IBEW. We want to do a shout out to Georgia Stand Up because they were the ones that sponsored that movie. And also to Burtis Downs down in Athens, Georgia. He sponsored the movie. It was a packed house. We also had it shown in Savannah, a packed house, but we're going to show it several times around Georgia. It's not free to us, but we try to make it free to the public. This movie, there is nothing in this movie that was made up by Hollywood. It is just the plain truth in terms of what's happening. It features Philadelphia public schools. And what the governor did there was to cut that spending in that state, and especially in Philadelphia, by billions of dollars over the state, ending programs such as, well, this is not a program, librarians, which were no longer in libraries. A school without a librarian, can you believe that? You could go into the band rooms and you would see instruments and band uniforms, but no music teacher. Now, we know that we are now in the age of technology. And instead of our schools being elevated and teaching done to the state of the art, they're taking us backwards. And then what happened is that the state created a bill so that they could take money over to charter schools. Well, let me say this, I'm going to tell you my age. I was born in 1856 right here in the city of Atlanta, 61 years old. And I have been a member of my union, the Atlanta Federation of Teachers, since I was 28. Our national organization, the American Federation of Teachers, invented those charter schools, but not the ones we have now. The charter schools that we have here in Georgia have little accountability, little transparency, little oversight. And what's happening is that taxpayers are paying for somewhat quasi-private schools. These schools select who go into the schools. They can choose, and you were asking me about special education earlier, to not serve as special education students. And what's happening is that, you know, in Atlanta we have great gentrifying going on. And communities being put together all over the United States, but especially here in Atlanta. And you have these companies running schools, and they're saying, oh, look how great these schools are. I'm not going to call them the names, unless I'm given permission. And then they go out and they court other cities. Usually these are minority cities, in places in poverty, such as Syracuse, New York. And they convince these boards who are composed of minorities, which don't know what to do, because they're lay citizens, And they say, okay, we have a formula that would work. Let me show you what's happening in the great east part of Atlanta or the great west part of Atlanta. But what they're not saying is that the majority of the parents there, income is above poverty level. They're gainfully employed. Many are professionals. The children, thank God, can have experiences beyond the classroom. They're not talking about the socioeconomic conditions and the health conditions and the disparity that so many parents and families are in that hinder them from being able to talk about EM square or the H2O or algebra or algorithms, and except they can't even talk about that because they're so busy trying to eke out and scratch out a living. So in Atlanta, we're in elections right now. And we have seen the Atlanta Board of Education systematically turned over, a rose by any other name is still a rose, to for-profit companies. Mm-hmm. And that's the scheme. That's part of that Betsy DeVos' scheme. That's part of Donald Trump's support. That's part of what Nathan Deal has done. Mm-hmm. That's part of what some of our House leaders, both black and white, Republican and Democrat, have done. And it's a crime being perpetrated upon America. So that movie actually shows for people to see. There will be no questions if you saw that movie. What is happening?
So I want to say, Verdaillia, when you get the locations for where you're showing it next to Metro Atlanta, make sure that we know here.
We'll do.
And we will do a public service announcement to let our listeners know.
Thank you, Diane.
When they can go see that. So I have a question, and it's related again to the relationship of all of the kind of public services being privatized. Mm-hmm. So it seems to me that a great deal of public capital has been put into buildings, has been put into, if we talk about transportation, the rail systems and buses, roads, and then because the state deprives the entity or the city deprives the entity of the needed funds, then parents and consumers or riders or whoever complain that the service isn't as good as they want it to be. Mm-hmm. And so then the answer that's given is, oh, that's because publicly run things don't ever work right, and you need the profit motive to have people do right. And that to me is like turning the world upside down on its head. So could you talk a little bit about that phenomenon?
Well, when we go to many of the European countries, we see that there's public health. We also see public transportation and trains all over Europe. I can get around just fine in Europe, and they speak all these different languages in different countries on one little small continent. But in this country, the public must understand that the states are rooted in racism and classism. We have 50 states, and we go back and we look at the way the Constitution was formed, and we look at the Great Compromise, etc. They were fighting then in terms of territory, and then that fight continues. Nothing will operate without maintenance and money. And our government is not taking care of the people. The government is not in business for profit. It is in business for service. And we have gotten away from that in this country. We are the great democracy, the great experiment that is working, was working, and we're going to demand that it continues to work, and we're going to have to do some cleanup. You know, I'm not here today to talk about gerrymandering, but I really want to talk about that. We can do that next time. But as I said earlier, we have black, white in office, and a few others. We don't have, I think, a couple of Latinos right now in the General Assembly. But it doesn't make any difference what the office is. They've been cutting deals with each other off of the backs of the public. Last night, I was discussing with one of my colleagues parents that are 30 years old right now. Let's go back 15 years, when they were 15 years old. What would that be, 2002? Mm-hmm. Betsy DeVos was up in front of millionaires and billionaires out in Arizona at that time, talking about what they were going to do to schools. Now remember now, she didn't go to a public school. Her father made a lot of money off of the visors in the car. Y'all remember that when you put your visors down and you look at the lights? That was basically DeVos's daddy. And they made a lot of money off of Amway. Now, I'm not against that. But the woman doesn't have her feet on the ground. Okay? She does not have her feet on the ground. She decided that schools were not functioning, and therefore they were going to take them back for the religious right. Now, I'm a Christian, but I do not want a religion being forced on anybody. I don't think Christ wanted that. You know, what happens with our tax dollars? I hope I may be not answering your question, but what happens to our tax dollars when you start teaching witchcraft? Come on now. What happens? So, go back, Diana. What was your question? You were telling us that a systematic approach to dismantling public institutions. Yes, everything is going for profit. At City Hall right now, we have candidates who are running with extreme for-profit money. And money is green, and it's not red, and it's not blue. And there are candidates going to City Hall, many of them young, and I was talking about the parents' ages. They wouldn't have known 15 years ago what Betsy DeVos was doing. They were 15 years old. Now they're 30, and they're looking at, oh, these schools and, you know, the trains and the water and the streets. They have no idea because they don't have a point of reference and as to how it got that way. And so we are fighting a battle to educate the public as to what democracy is about, what our role must be to have accountable, transparent folk who will answer to us, who we are hiring through elections to work for us and not for their political careers so they can take the next step. Okay? So Atlanta is prime, I would say, ground zero for privatization. We have seen, especially minority cities run by minorities, where right-wing, that's what it is, right-wing money is coming in, buying folk off.
New Orleans after Katrina.
Oh, that was in the film, that's right. New Orleans after Katrina is a very good example. A natural disaster gave them what they wanted there. We had folk in the State House who all of a sudden, you're going to have to let me say this down here. All of a sudden, a black that's preaching to the community I live in as to why they should be elected to certain posts, went down and saw that devastation with Governor Jindal, would not come back and tell Georgia the truth. And we asked him, come back and tell the truth about the schools and the conditions down there. Okay? So that was that was natural.
So for everybody to understand, after Katrina, essentially all the public schools in the city of New Orleans went private.
And Arnie Duncan was...
Private companies.
Mm-hmm. Right, right.
And that's what this trip was that she's referencing, that people didn't come back and really talk about the consequences it had for special ed kids, all kinds of different people, children who were not allowed in.
Right, and when you look at those schools, you have kids going to schools and storefronts and churches, and everybody making their little money because there are no standards. They can just apply and get this money. But then you have these big corporations now coming up taking this money, and that's a great disparity in those schools in terms of where children go and are allowed to go. And of course, if they say the kid can't go there, they expel the kid for whatever reason, that kid goes back where? To that public school without the what? Without cash, which puts a bigger burden on the public school. This must be stopped. House Bill 338, for instance. You all, thank God, in Georgia, everybody said no with an H in front of it, that's heavens no, to OSD. Opportunity School District, but they turned right back around. Some folk went to the well, hello, and said, we're going to pass this thing. And they passed it anyhow, although the Georgia voters said no. We had one state representative, well, I haven't heard from my constituents. Well, the constituents didn't know what was going on. See? So this is another slick way of going in, taking money, saying, oh, your school failed. I was in a school the other day in DeKalb County, and the new state test, trying to think of the name of it right quick, they have come up from 48 points last year to 51 points this year. They have 700 students, grades K through 5, very transient population. About a third of the population turns over every year. I told the principal, I don't know how he's doing it. Wow. Building made in 1974, everything antiquated. the desk, oldest Methuselah. You know, I mean, you should see what these people are operating. The principal was out there actually drawing the lines for parking. Can you imagine that? That should not be. So stores and churches, etc., we are going to walk into those partners. Ask them to partner with that school in the school district. We're going to make that particular school a shining light, a beacon of hope, and then we're going to go out to the feeder schools so the schools will work if the parents know what to do. Many of those students have parents who are unemployed. They're living in those Motel 6s that, you know, turning them over, etc. The kids are in and out. They don't have medical services. They don't know where to go. So what do you do?
I'm gonna ask this question, and I think Paul has a question too, and I keep interrupting. So part of the thing that is so dismaying is the scapegoating of teachers.
Mm-hmm.
And so today's newspaper, for example, had an article about how the state is crying crocodile tears about all the money that it needs to put into the teachers' pension fund in order to fulfill its obligation to teachers who are not highly paid and who actually become teachers in part because there's the promise of a pension, which
I
not
have
a
to
lot of
answer
workers
this
have.
question,
Mhm.
and I love Delta Airlines. I fly Delta. Is it as much money as they've allowed Delta Airlines in tax cuts? Does it match that?
I don't remember, it was 335 million as I recall from the article, but I could be
So
slightly
let's
wrong.
compare it to what Delta Airlines has been getting in terms of their fuel tax cut and $25 on every bag. And that's just one industry in this state that is benefited from the tax dollars. Give you an example. I recently retired from teaching early with 29 years. I was short 30. And I got 60% of $85,000. That was taxed, and I pay my insurance out of it. And I bring home $2,200 a month. Can I live off of that in Atlanta? I don't think so. I don't think so. Pay up, state. Pay it. The money is there. We're giving it, you know, we're a great place to do business, except when it comes to human lives. It's a great place to do business for businesses. So those figures mean something, but that's not the whole story.
So back to the question about that the issue is always the teachers. The issue is not the building. The issue is not the condition of the homes and the family life that the kids come from. It's not anything else except teachers.
Okay, suppose we could get every teacher in Georgia to walk out and stay out right now for the next month. Then, is it the teachers then? Okay. So, these teachers are saints. One of the problems we have, though, is that a lot of folk won't go into teaching anymore. In fact, in labor unions, we would steer our kids into bakers and plumbers and laborers,
Apprenticeships.
excuse me, right. We would do that, doctors, etc. But we're not steering our kids into teaching. The reason is that many reasons. The pay is deplorable. The benefits are deplorable. You are treated probably like a prisoner of war. You're not treated like an adult. The support is not given to teachers that is needed. You know, other industries actually continuously educate their personnel because that's the golden goose. You're the golden goose, okay? But with teachers, with loaded classrooms and everybody coming in, and we love our kids, and as I said, all kind of conditions. And right now we have a lot of popcorn teachers. The teachers that people are being made into teaching. They have a degree, they come in, they stay 2 years, they get their loans paid off, and then they leave. That's the industry right there. Whereas we used to have communities, and in some cases we do, where the teacher actually knows the children and the parents and etc. So all of us have a job to do. It is not the teacher's fault, that's a lie. But I'm going to say, especially to our parts of town where poverty reeks, our social skills, churches and communities and people, all of us, we must help our parents and our parents must help us. I've been in schools on Fulton, on the north end, where elementary school teachers are teaching French, and at the end of the year, the parents are paying their way to France. Okay? And then I have been in some war zones on the south end of Atlanta, where people are walking in blaming the teacher. They don't know any better. Many don't know any better. They really don't. Until we get down and teach better. But now let me go to the extreme here, Diane. What are we going to do? Are we going to lock everybody up, put everybody in the Atlantic Ocean, or let everybody break into homes, enlarge the prisons, huh?
School
Come marry
prison.
our sons and daughters, and guess what? And can't make a living. So either we educate our population and get real and stop being so divided in this country, or all of us are going to go to a place with an H in front of it, and that's not heaven either. This is where we're going. I mean, come on now. So
What is, what Kathryn was talking earlier about single payer and the human right to health care. And if we say a human right to education, what would education look like? What is your vision of how it could be if it was done right?
well, where we have poverty, we need community schools so that we'll have some equity. There will be medical services right there. We have it in some schools in Albuquerque and so forth. Clinics, and I understand I have to take my hats off to Dr. Phillips, if you don't mind. She's breast cancer specialist out in Decatur, and 2 days a week and half a day, she's at several schools in DeKalb County right now, helping children and families with their health needs. So that's one thing. Then there will be wholesome food. We would have food catered in, and pizza all the time, and rolls and potato chips, and homogenized milk and sugary drinks. All right. We would have smaller classes. Teachers would be have professional say-so as to how classes should be set up, how they should be taught, what materials work best. Well, I can just make it short. We would have an educational system that looks like Finland. And the people would just take a look at Finland. And I'm tired of folks saying to me, yeah, but Finland doesn't have the diverse population that the United States has. Well, that's an excuse. That's an excuse. In Finland, teachers, first of all, go to school 4 years in a discipline, and then 4 more years to become a teacher. Then they are mentored before they become a master teacher. And when policies are made in that particular country, the teachers are making them because they're the professionals, just like doctors. They know what equipment they need, how they need to seat the children, how long the day should be, and etc. So that's what it would look like in this country, in a nutshell.
All right, Verdaillia, we're gonna have to have you back.
Yes, ma'am. I'm so glad to be here.
Talk about gerrymandering and gentrification.
Yes.
Those G words.
Yes. Oh, yes. Those G words. Yes.
All right, so y'all, I want to remind everybody about the challenge that Verdaillia offered. The teachers union is contributing $100 to WRFG. During our pledge drive. We would certainly like many of you to come out and match that. And if you do, as I said, a $100 or more pledge on a credit card will get you 2 tickets to our December 3rd Carnival of Cultures, which is our next very big WRFG fundraiser. I want to thank our 2 guests, Kathryn Dirks from HSTAT and Verdaillia Turner from AFT. And thank you both very much, and also thank you for